A damning report reveals patients are 5 times more likely to die on PMH's public ward. The Prime Minister slams rich critics of national health insurance, plus an emotional scene as 2 murder victims' families return to the crime scene. We've got those stories and a whole lot more tonight. I'm Vuonic Toot and NB12 starts now. Topping news tonight, patients between ages 18 and 64 who are admitted to Princess Margaret Hospital's public ward are more than 5 times as likely to die than those admitted to the private ward. That's according to a report by Costa Rican consultants Sanagest International. The report also found that for patients over age 65, the likelihood of death is more than double on PMH's public wards than on its private wards. Dana Smith has the details.
Sanagest, the Costa Rican company advising government on its plans to implement national health insurance, found that for the year 2012, the mortality rate for patients ages 18 to 64 stands at 2.7% on the public wards of PMH, compared to 0.5% on the private wards. The mortality rate for patients over 65 stands at 14.8% on the public wards, compared to 6.9% on the private wards. The figures do not include patients in the neonatal intensive care unit or the intensive care unit, which would increase the mortality rate in the public wards. The report noted there are reasons for the wide variations between the public and private wards, which highlight possible inequities. It said the public wards admissions include greater severity in illness and a high rate of emergency admissions. However, Sanagest said given the data is adjusted for age, it is not likely the differences in severity are that extreme to explain a doubling of mortality rates. Overall, according to the report, PMH has an average mortality rate of 4.6, more than 3 times the United States average mortality rate of 1.3%.
Health Minister Dr. Perry Gomez responded to the report today. He said although the Princess Margaret Hospital could be improved, it is doing good work. He said he wouldn't rush to judgment on the report's findings.
That is, I'm sure what Sanagest recorded is accurate. Now, how does that compare with institutions in other countries, private ward versus public wards, because many of our sister nations in the Caribbean have the same setup. I don't know, I've never seen data like that from any place else to compare it with, So I wouldn't rush to judgment on the figures. It's absolutely different, right? And you can't compare apples with oranges. It's a different kind of population that's in one part compared to the other. You have wealthier people in a private setting and poorer people in the other setting. And so how do you compare morbidity and mortality in the two things, as a reflection of care?
Gomez said, having worked in PMH for more than 3 decades, he knows PMH provides great service and at times provides too much. But he agreed the report speaks to the need to not only improve service at public wards, but also implement national health insurance, something Sanagest also pointed to in its report. It noted there is a clear issue with equity and access to care, and over time, NHI will help address this issue.
Absolutely. And that's why we want to introduce universal health care, so that we create the equity for health care. That's what we've been talking about. If anyone has heard me speak on this matter, that's what it's all about. And the newspapers this morning made the case for it.
Health Minister Dr. Perry Gomez said in Parliament last week, if you are black and you are poor, you die. It was a comment Prime Minister Perry Christie had originally made when speaking about the need for national health insurance in the Bahamas. Government has said it intends to implement NHI in January 2016. From the Princess Margaret Hospital for NB12, I'm Dana Smith.
Prime Minister Perry Christie hit out at critics of government's National Health Insurance Plan today. During an event hosted by the International Labour Organization, Christie said NHI's most vocal critics are politicians, whom he said are covered by the state, and rich doctors who can afford insurance. Kyle Joaquin tells us more.
Christie veered away from his prepared speech Tuesday morning at the International Labour Organization's meeting for Caribbean Ministers of Labour. The Prime Minister decided he would respond to all the critics of the government's proposed National Health Insurance Plan after it was revealed that Costa Rican consultants at Sanigest Internacional recommended 3 forms of taxation to fund the plan. Former Deputy Chairman of the Free National Movement and cardiothoracic surgeon Dr. Dwayne Sands said the Bahamian people are already overburdened by the implementation of value-added tax, and the imposition of a national health insurance tax would effectively leave many of them broke. Well, today, in response to that, Christie had a word for the politicians and those he called rich doctors.
That their health insurance is contributed to by the state. And for rich doctors to know they could buy it. But every day people die because they can't afford it.
The report revealed that the tax would cost taxpayers between $362 million for a basic benefits package and $333 million for an expanded benefits package. Christie said there is a culture of division within the society that works against progress. He added that the country has already gone over $100 million a year in paying for insurance. Christie said the government simply cannot put off national health insurance anymore. And here's why.
If we hesitate again, there are people by the hundreds who, when we analyze why they died, it'll be because they didn't have the means or even the knowledge, and they didn't live in a country that provided it through the intervention of the state, and will be subject to the same animalistic manifestations of the strongest survive.
In addition to that, Christie says the government has the nicety of public debates over what it should do and what price should be given to human life. He says the state or the government should always recognize that there are people who cannot afford to buy their own health insurance. Christie pointed to families like his who may have a disabled child but can't afford health insurance.
And that there are people in our country who every morning they wake up, they do not know what to do with their child or children who are affected similarly. And that the country has not yet reached a point where it will accord to them the privileges and benefits that I could pay for my child.
Now, despite all of the criticisms, government still has plans to bring national health insurance on stream by January of 2016. Reporting for NB12, I'm Kyle Joaquin.
In other news, the Public Hospitals Authority has pledged to significantly reduce emergency medical services response time to under 4 minutes. This after a report completed by Costa Rican consultants revealed that the average response time for emergency transport in New Providence is over 30 minutes. First response by a basic life support provider should be less than 4 minutes, while arrival for advanced life support should be within 8 minutes. However, data from July 2012 to April 2013 revealed that EMS ambulance services provided an average response time of 34 minutes in emergency and non-emergency transport cases. Managing Director of the Public Hospitals Authority, Herbert Brown, says that will change.
Our intent is to reduce our response time within 4 minutes from the time we would have received the call. And so we are hoping that in the future, as you heard, that we will be able to increase our fleet and as a result be able to significantly improve our response time.
Health Minister Dr. Perry Gomez says he's not surprised by the long response time.
It's not surprising given the kind of terrain that we have to drive on, the traffic in the Bahamas, particularly in Nassau, that account for some of it, but we must improve on all these indices.
Their comments came as a $70,000 ambulance acquired by the Royal Bahamas Defense Force in 2013 was handed over to the Ministry of Health this afternoon for use in Grand Bahama. That island currently has 4 emergency response vehicles which have not been properly maintained.
I trust that it will be used for the benefit of the citizens of our island. The island of Grand Bahama, I understand that it's going to be used. And initially, we thought it would be going to Bimini, and we thought it would be used in New Providence, but circumstances have arisen, and we're very happy, Dr. Gomez, to be able to part with this in your safekeeping.
Gomez says in order to improve emergency medical services, the Ministry of Health expects to receive 21 ambulances over the next year. 6 will be sent to Grand Bahama. An emotional scene on Plantal Street this afternoon as relatives of 2 men killed in that area last month returned to the murder scene. Simone Davis has the details.
Relatives of both victims slain in the Plantal Street shooting say they just want peace in their neighborhoods, and they're hoping that that incident does not lead to retaliation and more deaths.
Finish justice in this nation. Finish justice in this nation. Because this nation is gone. It's gone. I'm burning a stepdad. He need a stepdad. He need a stepdad. Yeah, my best right now. Very blessed. He need a stepdad.
Painful memories, outrage, and confusion resurfaced today as family members of 2 men who were gunned down last month gathered at the scene of their murder to call for justice. According to police, a man was standing on Plantal Street when several people in a silver SUV drove onto the street and started shooting, hitting that man and 3 others. Renato and Henry Johnson died at the scene. Renato's father, Randy Johnson, says his son, a painter by profession, was mannerly and helpful. He says his son took care of his 95-year-old grandmother until his death.
It hurts. It really hurts. It really, really hurts. My son was a very helpful person. My mother is 95 years old. I work at night. When I'm too tired to bathe her, he would bathe her. When I'm too tired to feed her, he would feed her. So he was an understanding, loving child.
Johnson said he is now left to take care of his 6-year-old granddaughter Renato left behind.
That's my granddaughter and my daughter now, and my granddaughter. As a matter of fact, my son, he left an indelible mark in my heart. You know, it would never be the same. Never be the same. He was one of a kind.
Meantime, Henry Johnson's mother was inconsolable today as she grieved the loss of her only child. As family and friends attempted to calm her down, she just kept repeating that her baby is now gone forever. Henry was the first man to die in that shooting. After his mother fainted at the scene today and was lifted into a vehicle that took her to the hospital, her friend Deidre Harris told us that she has not been well since her son was killed. She said Henry was an innocent person who was killed for being in the wrong place at the wrong time.
She hasn't been well at all. She hasn't eaten anything. She cries all hours of the night. She hasn't slept for days. It's just hurting her, and that was her only child. He was a well-dressed young man, always mannerly. Never get himself in no problems. He was never a gangbanger. All I could say is just wrong place at the wrong time. But I asking anybody out there to please come forward with any information pertaining to Henry.
Community leaders are appealing to the public to help tackle the country's crime problem.
I also want to send a plea out to all the communities in the Bahamas to let's put down these guns and stop this senseless killing. Because at the end of the day, you leave a lot of youngsters without parents, without fathers, without mothers. And this is not sending a positive message. We got to try our best to resolve our differences other than bloodshed. And this community will not rest until those responsible are brought to justice and held accountable.
CEO of Caskets for Less, Kemuel Cox, said they are searching for the best way possible to help the Johnson families pay for their loved ones' funerals.
And we are asking the community to come out starting tomorrow, between the hours of 6 and 8. We will have a visual where we would come, the community will come out and try to lend helping hand and support this family as they go through their sad day.
Reporting for NB12, I'm Simone Davis.